So today we're going to talk about treatment for gummy smiles. So typically, the way that you first discover you think you have a gummy smile, for most patients, it's just looking in the mirror. When they look at their friends and their family, um, they notice they don't display as much gums as maybe you do when you're looking in the mirror. And ideally, the gums are supposed to frame the smile, supposed to frame the teeth, just like the frame for a painting. But sometimes, just the way that we're made, the gums take more center stage than just framing the smile. And so today we're going to talk about things that we can do to improve the way our smiles look if we have a gummy smile. And people do notice your smile. When you look at this picture, you know, I've got a bunch of these that are like this. The first thing you notice is that the notch in his tooth. Is that correct? But do you notice he doesn't have a right ear? So your smile makes the first impact, the first impression that people see. I've written a paper on just this process of treating gummy smiles and published it in the Journal of Cosmetic Dentistry. And I'm going to go over that technique a little bit today to give you an idea of what's involved as well. So one of the techniques we use to manage a gummy smile is called crown lengthening. And we typically do it with a laser. Before lasers came along, this was all done with scalpels. And the advantage of using a laser is, one, it's a lot more precise than a scalpel. And the other thing, it's minimally invasive. And so what I mean by that is, if I was doing a surgery conventionally with a scalpel and regular instrumentation, that bottom right picture was taken immediately after surgery. Notice it's a little red, but it doesn't look anything like a surgery would look immediately after surgery if I was using a scalpel. So the laser improves hemostasis, which is bleeding. So with a laser, there's less bleeding, there's less swelling. And because there's less swelling, there's little or no pain associated with it. And that's a big deal. So laser surgery has some advantages for us. It prevents swelling, and what you see is what you get. So you can see the result immediately after surgery. Before we begin doing a surgery, though, we wanted to try to determine what's the source of the gummy smile. Then there's a lot of possibilities. One could be patients with a hyperactive lip. Maybe their upper lip just has a tendency to rise when they talk. Or maybe the distance from their nose to their lip is really short or really long. Could be either way. And it could be, too, that there's other situations that can occur with the teeth and the lips. And we need to determine what part of that is creating the gummy smile. So the first thing we do is we have some smile design software. I can take a photo of you and show you before and after pictures before we actually do anything. And that comes in really handy for trying to determine how to manage a gummy smile. So face height. One of the things we want to look at is the middle face from the eyes to the nose. Is that distance right there, that mid face, is it in a one-to-one relationship from the nose to the chin? And you'll see in patients that typically have a gummy smile, sometimes the lower half of the face is bigger than the middle part of that face, and that difference in proportion can create a gummy smile. But like I was saying earlier too, it could be that you have a high smile line. When you smile, your lip just raises up really high and exposes more of your teeth and your gums. Other things that could have impacted, are your teeth short or really long? Some patients, when their teeth first started coming into their mouth when they were kids, the gingiva attached to the clinical crown, and as the tooth was coming down out of the alveolus or out of the bone, the gum just stuck to it and it never receded back to the neck of the tooth. And that creates a short tooth appearance and a gummy smile. That's actually very common too. We see that that's probably the most common cause of a gummy smile is the gums stick to the teeth as the teeth erupt into the mouth. And sometimes the bone itself attaches to the clinical crown, and it's brought down unevenly as the teeth erupt into the mouth. So there's just a lot of different things that can create a gummy smile. The when we're doing when we're considering doing a procedure to enhance someone's smile, I like to see someone's smile fade into the corners of their lips. So when they smile, you want to see that smile go into the corners of their smile line, the corner of their lips on either side, and then you want the incisal edges to tend to follow the lower lip, and that creates an appearance that you see so often on magazine covers and things like that. This is an example of short teeth. So this patient has worn down their teeth and from clenching and grinding, or maybe they have a really abrasive diet. There are some populations that eat really abrasive foods, and that can wear down the teeth. But for most patients, it's from clenching and grinding your teeth. And we do a crown lengthening type of procedure for patients that have short teeth like this. It's called functional crown lengthening, and it's to prepare them for getting crowns. Other things that can cause gaps or make your smile not look as good as it could when you're smiling is the types of contacts you have between your teeth. So in this area on top, this second photo, you can see lots of black triangles between those teeth. And that's actually because of the way the teeth connect to each other, or they're standing next to each other. That interproximal, or the contacts between the teeth, are in the wrong spot. And as a result, that causes the gums to recede. There's a way to correct that. If they're too narrow, like the bottom picture, that also creates gaps in the smile. And again, that's just a problem with the way the crowns enter contact between each other. And that can be corrected as well. Another concern that we have before we do any type of procedure is how much gingiva is around the teeth. There's actually two types of tissue in your mouth. If you were to pull on your cheeks, they're springy. And that's because the cheeks on the inside are lined with an elastic tissue called mucosa. And the tissue right around the teeth, it's denser. It's more like leather. And that's called gingiva. And so you want more gingiva right around the teeth, whereas you want mucosa in your cheek so that you can open your mouth. Other things to consider is how thick or thin the gums are, and that impacts what type of procedure we would do to correct a gummy smile too. So in this particular case, this young lady came to me, and you could see that her teeth look a little short. She wanted them to look longer, especially after she'd finished all the ortho. The problem is she didn't have much gingiva around her teeth. She had more mucosa. And so we had to do a procedure called osseous crown lengthening. It's a different type of surgical procedure that we didn't really use a laser to do. And we did preserve the gingiva, the tight pink tissue. Look at her after photo and notice that the tissue around all those teeth is a dense pink tissue, not a springy, thin mucosal type of tissue. And we also have to remember that beauty's in the eye of the beholder. This lady is a model, and she was losing magazine covers because she could see, when you see her smile in that top photo, you could see gingiva or papilla between her teeth on the right side, her right, and on her left, you couldn't see anything. So she wanted everything to look symmetrical to get magazine covers. And so the type of crown lengthening we did for her was what you see on the bottom. We were removing that much tissue to create symmetry. And we did that with a laser, and you can see the before and the after. She has a more symmetrical smile now. In this particular case, she's finished ortho as well, and she's actually learned to hide her smile. It took a long time to get her to smile a broad smile because she's learned to keep her lip over her gums and her teeth by not smiling. And so for crown lengthening for her, it's going to change everything. So let's watch this. I'm going to take you through a surgery. So if you're eating lunch, this is going to have a little blood in it. So part of this is the top photo is I'm actually making some points or some I'm making bleeding points in her gums at the length of her natural teeth. So those red dots you see in her gum, I made those because that's actually the length of her natural tooth. And then the bottom extra or the bottom photo, I'm using a laser to reshape her gums to those bleeding points. So after I've reshaped the gum to those bleeding points, I have to reshape the bone to actually make it follow the gingiva. So the bone is what supports the gums. And if you have too much of it, it can cause the gums to rebound. And so you'd have crown lengthening done or a smile aesthetics type of surgery done, and it would rebound in 6 months to a year if you don't treat the underlying support tissue the way you treated the soft tissue above it. And so that's immediately at the end of a surgery. And there weren't any stitches in this surgery. Instead, I used glue. So at the time that I've recontoured her soft tissue and her bone to make the appearance that you see there, then I sealed it with a glue. So no stitches in this type of surgery either. And this shows you before and after. And this made a huge difference for her. She's no longer tensioning her lip trying to hide her teeth anymore. She can smile more relaxed. It makes her lips look fuller. This is a same type of case, but a little bit longer duration. So you see the before, and then you see 6 months later. So that's the length of her that's the natural length of her teeth. She really had bigger teeth, but the gum had covered over the part of the clinical crown, and you just couldn't see the natural length of her teeth. And that I will tell you, that is probably the most common thing that we see in patients that have a gummy smile. Another type of case. This is a 1-year post-op, just showing you that the results last after we do it. And so you can see she has a gummy smile before, and she's not really tensioning her lips trying to hide it. She's just aware of it. And then the 1-year post-op is on the other side. So advantages of crown lengthening with a laser. It's a minimally invasive surgery, doesn't bleed much, and it's stable after I do it. And you can see the outcome immediately. Whereas if I was using a conventional instrumentation to do it, scalpels and sutures and things like that, what happens is when you take the sutures out about a week to 2 weeks later, the tissue kind of shrinks up a little bit and it's uneven. So in about a month after the first surgery, you have to do a revision surgery to make everything look perfectly symmetrical. Then you have to wait another 2 to 4 weeks before that tissue is completely healed. So it's a 2-month healing process. Whereas with a laser, what you see is what you get at the end of a procedure. It's much faster, much more minimally invasive. I like these types of cases. This is a case where a patient had a root canal and the root canal failed. And her teeth weren't exactly even before the surgery. Her smile wasn't. She had the crowns and the implant, the 2 crowns weren't exactly symmetrical. So in this particular case, she lost her front teeth due to the root canal failed. And then I replaced it with a dental implant. And then I used a laser to make her gingiva symmetrical right after I did the implant. So she ends up with a perfect smile at the end. This is a patient who's going through orthodontics. And a lot of times you see this, and especially on youngsters that aren't cleaning their teeth well while they're in braces. All that plaque gets trapped around these brackets, and it causes the gums to enlarge or overgrow the teeth. And so you can see in the middle shot, I've actually used a laser to remove the tissue, the excess tissue from around her clinical crowns. Notice how long her teeth are compared to the way they look with the gingiva on the right. So this is just called what we call clinical crown lengthening, and it's done with a laser in the office. And she had her braces put back on, and now you can see she has much larger teeth than the way they initially appeared. We see this quite frequently as well. So, and also notice the way that I've crown lengthened this lady's tooth. When she smiles, her smile line actually goes into the corners of her smile. So you see how the teeth fade in there? So when I'm crown lengthening or enhancing someone's smile, I actually will create that I'll contour the tissues in such a way that the smile tends to fade into the corners. I just think that looks good. This is a case where the patient has a long premaxilla. And so the maxilla is the upper jawbone, the mandible is the lower jawbone. And this particular patient had their premaxilla, that lower face, is much bigger than the mid face. And so they don't have an even proportion. So if I just did crown lengthening to the natural length of these crowns, you would still see too much gum. And so in a case like this, I have to do a procedure where I do a lip lowering procedure. So imagine that we can take someone whose lip is rising too high and actually reposition where it rises, so that one, after I do the crown lengthening and I do the lip lowering procedure, one, it makes their lips look fuller, which most women like, and two, it gave it a more even proportion of her smile. So a lip lowering surgery is when you've got too much bone, the premaxilla, that top bone for the top teeth, that part of the skull is just too big. And your options for managing something like that are, one, do nothing. Two, you could have orthognathic surgery. That's where an oral surgeon would take out a chunk of the maxilla. But in the risk of doing a procedure like that is that you could have to have root canals on all your teeth after it's done. And then the lip lowering procedure. And sometimes if you just want to see what the outcome of a lip lowering surgery is, we can place Botox in the upper lip, and it will relax the lip, and you'll be able to see what the outcome of a lip lowering procedure would be without having to go through the surgery. Or you could just do Botox every 6 months, and that would also help. It's not really a long-term fix, though. So here's a lady who had both. Her teeth are a little bit short, not too much, but her premaxilla is too long. Her skeleton's too long from her bottom of her nose to her chin. And so we're going to both lengthen her teeth and we're going to lower her lip. So when you look at this next slide, that's where her lip is lowered to. So now when she smiles, you don't see as much gingiva anymore. That's a pretty cool effect, isn't it? And it's a procedure all done with lasers in the office. It's not a long procedure. Another case just like that. This is a similar situation. The patient had a long premaxilla, and so we both lengthened her teeth and we lowered her lip. And so you can see the difference before and after. So there's lots of different ways to correct a gummy smile. Another case, this is a patient who didn't have, she was congenitally missing some teeth. And so she's going to have crowns to make her canines look like lateral incisors. But she also needs crown lengthening and lip lowering. And so we did all of that, and she had new crowns to make the appearance even better. So you can see that's a huge difference in the way things were and the way they turned out. Same type of case. I've got a patient who has now, her teeth weren't really too short. Her teeth are actually the right length. It's her lip that was too active. And so we did a lip lowering procedure, and that's how it looked after 2 years. So another case where a patient's losing a front tooth, but she has a long premaxilla and her teeth are short at the same time. So we did a crown lengthening. I also took out a tooth that was part of a bridge and placed an implant there. And then I shaped all of her gingiva to fade into the corners of her smile. So I hope this was helped you give an idea of how you can manage a gummy smile, whether it's yours or someone you know. There's ways to manage it. And if you have questions, you can always send me an email at fortbendperio@gmail.com or call the office. Or if you want us to evaluate you, if you say you watched this seminar, they'll give you a free evaluation to come in and we'll take a look and see what needs to be done. Thank you so much for spending part of your lunch with us. And if you have questions, let's see if I've got any questions on my little board here. And I don't have questions that I see. So if you have questions, you can always email me, or you can call, or you can come in for a free consultation. Thank you much.